getting the recording, and I'm going to go to live on Facebook. Stand by. We'll get started in a moment. Facebook is requiring me to log in and prove that I am who I am.
Ah, okay.
So many more steps. Security these days. All right, let's see. Okay, well, we'll go ahead and get started. Facebook's not participating with me, but what we're going to do is we're recording this event, so we will post it to our Facebook page later on. I'm Deb Neuman at the Bangor Region Chamber of Commerce, here with Anne-Marie Storey at Rudman, Winchell, and we are here to take your employment law questions. Let me see if I can change my screen here. Okay. All right, well, Anne-Marie, I'm going to let you go ahead and get started. I'm trying to see any Q&A that comes through. I just need to make a little adjustment here on my screen. But this is your event. If you have any questions, please use the Q&A feature on Zoom, and we will get to as many of your questions as we can. Anne-Marie, I appreciate you setting up this event with us today. There's just been so many things that have happened in terms of employment law, employers, and the pandemic, COVID, recent mandates, requirements for employers who employ more than 100 people, Biden's plan, a lot going on. I'm sure you're hearing from employers. So why don't you share with us what you're hearing out there and any thoughts you have about what employers are required to do right now?
All right, so let's start with the plan proposed by President, or set forth by President Biden, because that's, of course, the biggest news. It is a plan in progress. And so by what I mean by that, of course, is that part of the plan is going to require OSHA to issue an emergency temporary order enforcing the plan and giving us more guidance, hopefully, about how to do certain things and what all this means. But we'll start with what the plan actually is. So there's five separate pieces to this. And so the first one is that the plan requires vaccinations for all federal workers. Now I'm going to go back and we'll cover all these things individually, but just to put it out there. So number one is required vaccinations for all federal workers. Number two is vaccinations required for healthcare workers at Medicare and Medicaid participating hospitals and other healthcare settings. So that's beyond what the current order is under DHHS. This will cover all Medicare and Medicaid participating healthcare entities or settings. Number three is it's going to require COVID safety protocols for all federal contractors. So, and my understanding of this is that it only is going to cover contracts from now ongoing, but I'm not, we would have to delve more into that. But so federal contractors will be covered by this. The one probably most of our listeners are most interested in this one, which is that all private employers with 100 or more employees will have to ensure that their employees are either vaccinated or tested weekly. And we'll talk obviously a lot more about that. one of the things that it will do that isn't getting very much press at all is that it will require large entertainment venues to either require proof of vaccination or testing for entry into the venue. And there isn't a lot of information about that one yet either. And I don't know that a lot of people are aware, the other thing it does is employers will be required to provide paid time off to their employees to get vaccinated. So it's a very broad plan, and employers are definitely going to be affected by this. I have a lot of questions about it. I think everybody has a lot of questions about it. We do not have any direction from OSHA yet, of course, and what I've been hearing is that it's not likely we're going to get that until maybe November. And then, of course, there'll be a period of time during which employers have to comply with whatever the rules are. But I think it's useful to at least get the information out there now so employers can start to plan for it and raise some of the questions that we have about what it means so that people are aware of what might be coming. So the first thing, so let's focus on the private employers with 100 or more employees. So, and again, I know there's a lot of unknowns about this, and I will talk about those in just a few minutes. But just some pointers about this. So number one is it's either to be fully vaccinated or to produce a negative test result on at least a weekly basis before coming to work. That's the language of the order. And again, I know that raises questions. It does not sound like an employer would has to do so. In other words, it doesn't sound like this is an either or for employers. There's nothing about this language that will prohibit employers from still requiring their employees to be vaccinated if that's what they choose to do. Meaning, this doesn't say, well, now you can't require them to be vaccinated as long as they test weekly. That's just if you don't have a requirement that everybody be vaccinated, then that's what you'll have to do in the alternative. Okay, so it's not saying you can no longer require people to be vaccinated because you can. It also talks about, as I said, providing paid time off for workers to get vaccinated and to recover from any side effects of the vaccination. So one of the issues that we'll talk about is what does that mean in terms of pay for employees to go be vaccinated if they're not already, both for the time to be vaccinated and for any side effects of being vaccinated. But before we get, I guess, any further into the private employer, let me just mention, I said one of the things that the plan will do is that it requires public sector, state and local government workers, which includes educators and school staff, to be vaccinated. Now, Maine is a sharing entity with OSHA, meaning that Maine will be enforcing this for its public entities that are covered by this. And those include state and local governments, public school systems, the University of Maine system, the Maine Community College system, Maine Maritime Academy, the Turnpike Authority, and sewer and water districts. So all of those entities will be covered by this requirement, or are already covered by this requirement. The Maine Board of Occupational Safety and Health is required to adopt the OSHA rule, and that I think they have 30 days to give employers notice about what specifically they need to be doing. So in terms of the other timing, my understanding of the federal workers, because that's a separate category, remember there are three categories: there are federal workers, there's contractors, and there are private employers. Federal workers have approximately 75 days to become vaccinated. That's according to OSHA. For the, and the other category is the healthcare workers for Medicare or Medicaid covered entities. In terms of timing for them, apparently CMS, the Center for Medicaid Services, is going to be issuing an interim final rule, which becomes effective immediately upon publication, and that's expected sometime in mid to late October. So that should give the timing for those healthcare workers to be vaccinated. But of course, everybody, the administration is encouraging people who are going to be covered by this rule to get people vaccinated before then, so it doesn't become a timing issue. Now, in terms of private employers who are going to be covered by this, the timing, the clock, if you will, doesn't start ticking until the Department of Labor actually issues its rules. And so again, we don't know when that will be, but they're indicating that it seems likely that employers will have somewhere between 50 and 90 days to comply. That should be plenty of time for people to become vaccinated if they're not already. I think you need at least a 30-day window in order for that to happen. So it should be time for people to do that. There are penalties for failure to comply with this. The penalties that are mentioned now is that companies that don't comply with the rule can be fined nearly $14,000 per violation. But we don't know what per violation means. So does that mean every time somebody doesn't test weekly, if they're not vaccinated, that's a new violation? I don't know the answer to that. And I'm sure we'll find out more. For those entities that are covered by the Medicare and Medicaid services piece of this, my understanding is that the penalty, either the penalty or at least one of the penalties, is that CMS could pull its contracts for those employers who fail to comply. Now, just like the other emergency temporary order that we saw from OSHA, these are temporary orders. And so they're only in play for 6 months at a time. And then they either have to become a permanent OSHA standard, or, and that of course involves a formal rulemaking process. This process does not. So we can expect that it will be in effect for at least 6 months, and then we'll have to see what happens after that. But of course, it depends on the world situation as well. All right, so let's get to some of the issues that this raises. And again, I'm not going to have answers to these. These are questions that we are hoping that the Department of Labor and OSHA are going to clarify for us when the orders come out, but things to get you started thinking about it. Number one is a very basic, how do you count the 100 employees to know if you are covered? So in other words, does this mean you have to have 100 employees at one single location? Or are you going to be called upon to combine all of your work sites? And does this, what is the definition of employee? We don't know that either, whether it's full-time, part-time, half-time, per diem. I mean, one could surmise if the idea is to make as many people vaccinated as possible, that they probably are going to include all categories of employees, but we don't know that. Now, one of the things that OSHA, they did a telephone conference, and one of the things that they did address was whether or not remote workers would be included. And it sounds as though they will exclude fully and completely remote workers, because if they're not in the workplace ever, then they're not in the risk pool that these rules are designed to cover. But that doesn't mean that those people are not counted for purposes of determining whether or not you have 100 employees or not. The other thing we don't know is when the 100 employee count will take place. So in other words, is it 100 employees as of the date the president issued this proclamation, or is it 100 employees as of the time the DOL or OSHA issues its regulations about it, or some other time? We just don't know. And so that might make a difference to some employers as well. We don't know how long covered employers will have to come into compliance. As I said a few minutes ago, it's got to be at least a window of 30 days. I mean, at an absolute minimum, because it takes that long for someone to arguably to get the appointment and then get the first one and then the waiting time and then get the second one. So whatever that window is, and I mentioned the 50 to 90 days, it's got to take into consideration that kind of timing. Now, the weekly tests, there is a whole lot we don't know about those. In fact, we don't know anything. We don't know what kind of testing is going to be permitted, whether it has to be of a certain type. We don't know whether or not you have to offer that as an alternative to the vaccination. So in other words, if somebody, if it's the same as it is now, so that you have a vaccination requirement and someone says, I have a religious or a medical objection to doing it, that's covered by either the ADA or Title VII, do you then sort of revert to this weekly testing? And then what if there's some objection to the testing? So those are issues that will have to be sorted out. We don't know what the testing requirements are. So in other words, can an employer send its employees to an off-site location, or do they have to do it themselves? And of course, that raises a lot of issues, no matter what the answer is, because I'm hearing, and I'm sure everybody else is hearing from a lot of these off-site entities, like the drugstores and the places that are doing them, that they're running out of tests. And in fact, I saw recently that a lot of entities are no longer providing the tests required for travel because they just don't have enough tests to meet the demand. So if now employers have to send however many of their employees are not vaccinated and need to be tested weekly, that's going to put another huge burden on those testing areas. So we don't know how that's going to bear out. And then of course, if the employer tests themselves, that creates a whole host of new issues that we've talked about before, because then you have access to confidential medical information, and that raises a whole lot of different issues. We also don't know the very basic question of who pays for the testing, because the order as it stands right now doesn't say that. So it wouldn't be surprising if the employer were required to pay for the testing, although I think at this point, I think a lot of the insurance companies are, I think they're required to pay for it, right? So it's at no cost to individuals to have the testing, but I'm not sure that that may be the vaccination, not the testing. Sorry, I got that confused. So we don't know who has to pay for the testing, and this could be a big cost because we're talking about weekly. So every week, someone's going to have to incur the cost. But it's not just the cost of the testing, it's the cost for the employee to leave their place of employment, assuming that they're doing it during the workday, and have the test and wait there to do it and then come back with the result. But they can't, the language says it has to be done before starting work. So you can't have somebody do it at lunchtime if they've already been there through the morning. So how all this is going to work is not clear at all. And if vaccination, if the testing because someone has not been vaccinated is counted as paid time, does that also mean it's counted as time worked? Because if that's counted as time worked, you may end up with employees who have refused to be vaccinated and are now having to be tested, who are now being paid overtime because of the time it takes to go be tested. And you can imagine how that's going to go over with employees who have been vaccinated and are not going to be collecting overtime because they don't need to go be tested. So that's a potentially very sticky situation. So you've got two issues. Number one, is it paid time, which we don't know? And if it is paid time, does it count as hours worked? Meaning it can count toward overtime. And then, a lot of employers right now are working through providing increasing incentives for people to be vaccinated. So what does this rule do to those incentives? Are they even going to be necessary if the employer now has to say everybody has to be vaccinated or be tested? Arguably, they still could be relevant because I think employers still want to encourage people to be vaccinated as opposed to going to be tested every week, especially if the employer is the one who has to pay for the testing. We don't know what kind of proof of vaccination or testing is going to be required. So we're back to, I would say for proof of vaccination, we're no different than we were before, and you can ask for the card just like you've always asked for the card. The testing is more interesting because presumably the employee will come back with some sort of documentation from wherever they have been to be tested, because an employer is going to have to collect that information. But we don't know what record keeping requirements there are going to be for an employer to maintain the testing. And think about, from an administrative standpoint, who's going to be in charge? Somebody, you're going to have to probably designate one or two people to be in charge of communicating and organizing this with all the employees who have to go be tested every single week, and how to coordinate schedules. So if I have, 5 people in the same department who have to go be tested every week, they can't all go at the same time. So somehow you're going to have to figure out how to stagger these appointments, or, I don't know how the semantics of that are going to work. And then you've got the very basic issue of what paperwork is going to be required to be maintained. Because when you go test, you don't, I haven't had a situation where there's been a test where you actually get any paperwork back. I guess you do, because you have to show it sometimes to, as proof of a negative test. So we have to figure out what paperwork an employer would ordinarily get, and whether or not that's okay without violating ADA and confidentiality and all those other things. So that's another issue. We don't know whether or not this is going to affect collective bargaining agreements, or what the relationship between this requirement and those is going to be. I've seen many unions who have said that the issue of vaccination is a negotiating issue, and an employer can't just unilaterally put that on the union. So I don't know what the answer is when there's an order like this, and does that supersede it? And we'll just have to see. We don't know whether or not the FFCRA, so don't forget, the FFCRA ends at the end of this month. So that's likely before, I think it's pretty clear that's going to be before we get any guidance about what all this stuff means, and before the requirement goes into effect. So, because under the expanded FFCRA, an employer could allow an employee time off to go be vaccinated, and for any resulting symptoms or problems that they were having that necessitated them to be out of work, and apply the FFCRA so that they get a tax credit if they pay for that time. But as of right now, that's set to expire as of September 30. So whether or not they're going to sort of renew that in some form or another to go along with whatever the requirements are under this, I don't know. So I hate to focus so much on what we don't know, but those are the facts, and we'll have to wait and see.
Anne-Marie, you may have touched on this, and I apologize if I missed it. I had an employer ask me, what about if you have remote workers? So you employ 100 or more people, but they're not all working in the same location.
Yeah, I did. I think I think in terms of, my supposition is that those people would still be counted to determine whether you are a 100-person employer. But so far, at least, OSHA has given its indication that those people would not be required, would not be covered by this rule. They would not be required to either vaccinate or test weekly. But I presume that means fully 100% remote, no contact with the place of employment, no going in to get assignments or to attend a periodic meeting. I think if that were to happen, then they would be counted. But otherwise, it sounds like they might be exempt from it.
Yeah, well, that makes sense. That's a question that I've heard several times from employers. So thank you. If you have questions, please answer them. If you can answer your own questions, awesome. But like many of us, you probably can't right now. So use the Q&A function on Zoom if you have any questions, and we'll try to get to them this afternoon. I just think right now we're all just up in the air in terms of trying to make decisions about so many aspects of our business. I know we talked about this before we started, just trying to plan events and getting people together and what that looks like and doesn't look like, and canceling and postponing. And we're back in that uncertainty. And it's affecting businesses and employers alike. So.
Yeah, I think, you mentioned this, and I'm seeing it too, and that is that employers, I think, are in a quandary right now about whether or not to send people to things like conferences that they would normally be going to, and how do you decide whether that's okay or not okay. And I would say it really comes down to a couple of things. Number one is, common sense and how you feel about it as a business owner, and a weighing of whatever it is they were going to go do versus is it, is there a risk? And if there is it worth it? And then I think just following the CDC's guidelines. And so, I mean, I know a lot of the conferences, for instance, are saying you either have to show proof of vaccination or a negative test within, like a day or whatever of attending. And so there are measures being taken for safety reasons, but if you have employees and you're sending them to those things, I would just emphasize to continue the same safety practices you're finding in your workplace. So I would require people to be masked, and I would probably require it regardless of vaccination status at this point, given the CDC's recommendation and the increase in the number of cases. But again, would I send somebody to a sort of a voluntary conference that, in Florida just for the heck of it? Probably not. But I don't think, well, again, I think it's mostly a judgment call, but to ensure safe practices if you do.
And then there's the subject of travel, and we've talked about this in the past. And a while back, there was the requirement, if you traveled, you left the state, you left the country, you had to quarantine and test. And that's no longer required, but some employers are still requiring, if they have an employee who travels, to have them tested before they come back to the office. You know more about this than I do, Anne-Marie, but is that really up to the employer to make that determination if they want to require an employee returning from a different state or a different country quarantine or test, or both?
Yeah, I think that is, assuming that so maybe there are two different ways to look at it. One is travel that the employer required or sent the employee on. And then the other one is the employee's own personal vacation or, travel plans or whatever those are. And we talked about this at length earlier in the COVID process when there were rules by the CDC and the state. Now there aren't. And so again, I think it's a matter of common sense. And certainly if an employee travels for you, there's no question you have the right to control when they come back, whether they have to quarantine and what they do. But I think that's true of personal travel as well, to the extent that you know about it. I mean, it may be that they take a week vacation, you have no idea where they are or what they've done. 6 months ago, we were saying it's okay to ask employees to notify you if they went to a state that was identified as a high risk area. But now we're identified as a high risk area. So it's hard to say, but I think certainly if you know that somebody's going to an area that is one of those that's been identified by the CDC as high risk, then you're entitled to ask for testing or quarantine or whatever your rules are. You're just going to have to enforce it consistently, like we've been saying. And that's harder to do when the CDC doesn't have those lists like they used to of these are the countries that are okay, these are the places that are not okay, and these are the places that are absolutely forbidden.
Helpful. Thank you, as always. If you have questions, and we have quite a few of you joining us this afternoon, thank you for being here. Please post them in the Q&A and we'll ask Anne-Marie. School's back in session, as we all know. Are you hearing from employers who have questions about making accommodations for parents, given the uncertainty that is still going on?
Absolutely. And so there are a couple of things about that. I mean, as I said, we may very well see an extension of the FFCRA, because that's what it was designed to do when it went in place last year. And that is to help parents who were facing a situation where they had kids come out of school or didn't feel like it was safe for them to be there and didn't have any alternative care. I'm hearing a lot of stories about parents who cannot find care. So like most parents, I get the email every night from the school district that says how many cases there were and that they've been notified. And you kind of go, phew, I didn't get the call today, but it could come tomorrow. And you just don't have any idea when that's going to happen. And so you have parents who now have kids in quarantine, And even if the parents are vaccinated, somebody's got to be home with the child. So yeah, there are a lot of, that's certainly going, it's almost like it's going back to where it was before, and people are having to try to work remote again. That's why I think that there may have to be, or somebody must be considering whether or not there's going to be an extension of the FFCRA, because right now that's unprotected time. If a parent doesn't have saved up vacation or EPL time or whatever, then they're looking at unpaid time off. And, that's a hardship for everybody, including an employer who then doesn't have the person there that they need to have there. So, I don't know what's going to happen long term with that. And as an aside, one of the new pieces of legislation is the amendment to the unemployment law, and it adds that section to, there's a section that lists what a voluntary quit can be, when somebody can still get unemployment benefits if it was for one of several reasons. And they've added in a new reason, which is an employee has to leave unexpectedly for reasons related to child care or elder care when a service is no longer available and there's no other way to arrange to continue to be at work. So that's now going to be a category under which somebody will get unemployment. I think they were probably being awarded unemployment in most of those cases anyway, but those were the federal benefits, and those have now ended.
We had a couple of questions are coming in. So if I'm looking down, it's not that I'm not paying attention to you. I'm multitasking and reading these questions. This is related to employers and schools. Employees are still having to take time off work for kids whose schools close and parents have to stay home and miss work. These employees are still applying for unemployment. Will employers' experience rating be negatively impacted, or is DOL still paying unemployment for these times out of work? I don't know if you have the answer to that. I don't have the answer.
Well, I mean, the federal benefits have ended, so I don't know. And currently under the state benefits, I mean, that's exactly what this amendment was designed to address. But the amendment doesn't go into effect until October 18. So one might presume from that if somebody was in that situation right now and applied, they might be denied because it would be considered a voluntary quit. But that's only if they quit. So if an employer can put them on an unpaid leave or something, that might be a whole different situation, or keep them working remotely. But I don't know. I don't know what the DOL would do in a particular situation. And we don't know if the federal benefits are going to start up again either, because that's what was covering a lot of those situations.
There's a question here related to leave. I'm glad you brought that up, and this is regarding healthcare providers. I'm not sure some of the details of the question, but in a general sense, what if an employee has no PTO or no PTO left, and they need to take a leave, a parental leave, or they come down with COVID, or they have to quarantine, they have no PTO. What are an employer's options with that?
Well, I think the best course of action for the employer is to consider an administrative unpaid leave of absence while this situation is dealt with. And I'm assuming you're talking about a discrete time period, like I have to quarantine for 10 days. And so I don't have any choice. I can't be at work. I fully intend to come back. It's not that I'm trying to get out of working. I just can't be there. I would not recommend termination in that kind of situation. Even if somebody didn't have the PTO to cover it, I think you're much better served by offering some kind of unpaid administrative leave, or whatever it is you want to call that same kind of leave. Don't forget about the EPL that people are entitled to. I am having to remind some employers who have forgotten to keep track of that. And that's a situation where somebody could use whatever their EPL time is. But otherwise, if it's not the person's own health condition, it's probably not, well, unless, so there's a possibility that kind of leave could be covered by the FMLA if the person was needed to care for a family member who was out with COVID and was sick. So that's another possibility. So don't forget that the FMLA could potentially apply. But if you go through all the leave and they don't have any paid leave and none of the leave laws apply, that's when I think you get to an unpaid administrative leave of absence, or find a way for them to work remotely, and then you don't have to worry about the problem. Now, that's a different situation than when you have somebody, let's say, who just says, I'm just not going to wear a mask and I'm not vaccinated and I just feel like I don't need to, or I'm vaccinated, and because I'm vaccinated, I refuse to wear a mask, even though you've said that that's what this place of employment is going to do, because an employer can require that. So that's a completely different situation. And if you have somebody who simply refuses to comply with a workplace rule, like wearing a mask, that is not the kind of situation. I mean, there may be some extenuating circumstances, but generally, that's not the kind of thing where I would recommend an unpaid leave. I would look at that as a disciplinary issue that will result in termination if the person doesn't do what they've been asked to do. And that's assuming, of course, that this is voluntary. They're choosing not to wear it. They refuse to wear it. It's not for a medical reason. It's not for any other protected reason.
We had an interesting question come in. Part of our business is involved with over-the-road transportation, and our drivers can be out for 2 to 3 weeks at a time. We are all aware that there is a very low vaccination rate among the driving community. First question is, assuming the drivers choose to not be vaccinated, how would we manage the testing program when they're out for 2 weeks? Second question, what kind of recourse will there be if there's an exodus of a number of employees for a company that refused to be vaccinated or tested, and this results in a significant loss of business due to the loss of these employees?
Well, the second question is a purely political. I mean, I don't have the answer to that. I'm not in charge of the rules. I'm just trying to interpret them for you. So I hear your pain, but I don't have any answers for that. The first part of it is, again, it's going to be dependent on what the DOL and OSHA tell us about interpretation of this order from the administration. But my guess is having people on the road is not going to be an excuse to not have them tested, because they could be tested wherever they are. So it may be that the rule is, if they're not within your scope of, a place of employment, then you're going to be in charge of finding a place for them to test, depending on where they happen to be at that point. But again, that's pure speculation, and we'll have to wait and see what the rule says.
Yeah, questions are coming in. Thank you for your patience. I'm working with Shelley Sund, our Director of Marketing and Events, and she's sending these my way. If you have questions, use the Q&A. These are really interesting. This is an unemployment question, which I don't think we really can answer that. Related to leave. And the other thing we're seeing, Anne-Marie, is there is a concern among employers around losing employees. It's happening in every sector. We're hearing it all over. There's already staff shortages and concern that requiring vaccinations, and they don't want to be vaccinated, and so they're quitting their jobs. I don't think that is that anything you can address from an employment law point of view?
I mean, it's not. It's the only thing I'm working with some employers on what kind of incentive they can provide that doesn't go over and above what's technically allowed under the EEOC, which is unclear because there really is very little guidance about what's okay and what's not okay. And some employers are going to face an issue, I'm quite certain, with employers who work in areas where they have to have a certain number of people, like healthcare organizations, and they have to have a certain number of a certain kind of skill set. are going to have a problem when they start losing people, and there's the potential to have to choose between, do I continue to operate and care for these people, even though I don't have the right, technically the right ratio of employees to people I'm caring for because they've left because they won't be vaccinated? Or do I shut down? And then if I shut down, where do all these people go? And what kind of obligation do I have to them to make sure they stay safe? So it's a huge and very scary issue. And I unfortunately don't have any of the answers to that.
Are you hearing from employers any, I want to say this the right way, who are running into perhaps morale issues, even potential harassment issues between vaccinated and unvaccinated employees?
Yeah, I think, I mean, I certainly am hearing about, if nothing else, there's resentment. If somebody is not vaccinated and nobody knows why, so you don't know if it's for a good reason or for no reason at all, or a bad reason, according to some people. And then all of a sudden that person has to be out because there was an exposure in their family or somewhere where they were, and now they're not vaccinated, which means they have to quarantine for 10 or 14 days. That puts an additional work burden on the other people in that area. And so I'm absolutely hearing about resentment. And when that person comes back, I'm talking to employers about reminding everybody that they have to remain civil, and that, confrontation about this is not going to be okay, and that the regular work conduct rules will continue to apply regardless of the reason why somebody was out. It's more a matter of, you can't worry about why, you just have to worry about how to deal with it and to move on. But that's absolutely becoming an issue.
Yeah, we're hearing that as well.
Or the other way we're hearing it is, with kids. So kids
right.
whose parents are not vaccinated then go to school. And then if the kid tests positive, this isn't so much an employment situation, but now you've got a kid in a room, and now there are going to be a group of other kids who are going to have to be quarantined, and that creates a big mess. And so there is, that's a whole nother area, but that's beyond what we're talking about.
We're in the process of updating our employee manual, so this is top of mind for me. Should employers be updating their manuals or policies to reflect all of these changes and their policies and procedures regarding vaccination, masking, etc.?
Yeah, well, I mean, that's a great question, but mostly I've been recommending that employers have separate policies from the handbook, because this changes so frequently. You don't want to print a whole handbook and then have parts of it where you have to change it or remove it every week or so. So just like a lot of times employers do this with benefits, because those change too. And so the section in your handbook may say, please refer to the separate handout on benefits. And I think that's true with COVID too, because we have new policies, it seems like weekly, about protocols and testing. And so I think it's perfectly acceptable to have those in a separate way and communicate them either by email, if everybody has access to email, or however best you can make sure everybody sees them. But I think it's okay to keep those separated from your normal handbook. Deb, you're muted.
Good thing I'm not trying to chew gum. That would be bad. I was just looking, because we have had some questions related to unemployment. We have just confirmed today that we're doing an early bird breakfast, a virtual early bird breakfast, October 13th at 9 a.m. with Commissioner Laura Fortman from DOL, and also Commissioner Heather Johnson from DECD, and Dan Bellier from the Maine Community College System. So this is all going to be about workforce. So save the date, the 13th. We don't even have anything posted about it yet because we just booked this morning. these are many of the questions we're receiving about unemployment and where do I find workers, and all of that. So that just came together this morning. Just want to make you aware that that's coming up.
Yeah, that's great.
Yeah, that would be good. And then last week we had, we interviewed Dr. Jarvis from Northern Light Health and Dr. Kaufman from St. Joseph's. That is on our Facebook page if you want to check that out. They were really helpful in understanding where we are with the pandemic. And of course, a lot has changed in the last few days, but if you would find that information helpful, check that out on our Facebook page. Any other questions, please ask them through the Q&A. We're at 3:45 and we want to wrap up by 4, or we'll wrap up sooner if we've covered everything that you're interested in hearing about today. We should definitely try to do this in another few weeks, Anne-Marie, since things are changing, if you're available.
Yeah, and certainly as soon as the rules and regulations about this come out, there will be a lot of conversation. I'm certain. And
remind us again when you think that's going to happen, looking in your crystal ball that you have at Rudman Winchell.
I don't think it's functional at this point. I mean, I'm hearing everything from no way until November to it could be October. It's kind of like the vaccination for the younger kids,
Yeah.
It's just, you never know when it's going to come, and hopefully sooner than later.
Anything you want to rinse and repeat for us that we started with when we opened this session to make sure that people are aware of?
Just one sort of interesting issue that came up for me recently, and that was I was talking with an employer about incentives for vaccinations, and we got to talking about the possibility of a lottery. So instead of awarding small sums to employees, they wanted some larger incentives, but couldn't do that for everybody. So the idea was there would be a large incentive and it would be more of a lottery situation. And I think that's a very interesting option. But there's an issue about potential gaming and whether or not that's covered by some of the lottery rules. So we're looking into that at this point, but I just want to raise that as an issue in case anybody out there is doing something similar. Make sure you don't end up violating other rules by trying to stick to the incentive stuff.
Okay, great point. We'll go ahead and wrap up. I don't see any other questions coming in. Anne-Marie, are you okay if I give out my email, and if we do receive any questions, I forward them to you?
Yeah, sure.
Within reason, of course.
Yeah.
Could you rewrite my entire handbook? That would be great. It's my email is deb, at bangorregion.com. So if we sign off and you're like, oh, I had one question, just email it to me and we'll get you the answer. We'll try our best anyway. Deb at bangorregion.com. Anne-Marie Storey, Rudman Winchell, thank you so much for being with us this afternoon and staying on top of all of this so the rest of us don't have
to do it. It's my life.
On a personal note, can we just talk about what you did this weekend? Oh, please.
Okay.
Okay. This woman ran not one half marathon. She ran two half marathons this weekend. So she may not be able to get up from her chair at the end.
Right. Yeah, I'm waiting for you to sign off before I actually move.
That's amazing. You're amazing.
All right, so now you said that. Now I just have to say that my time on the second one was only 6 minutes slower than my time on Saturdays.
Amazing.
And I got a mermaid medal.
Cool.
Made it all worth it.
That's all worth it. Thank you for inspiring us. Oh my gosh. And for your help this afternoon. So thank you all for joining us. We have recorded this. This will be up on our Facebook page later on today. And stay tuned. I'm sure we'll send out an announcement when we reschedule another employment law check-in with Anne-Marie, and Rudman Winchell will send something out, I'm sure. So thank you very much.
Thank you. Have a good day.
No running this afternoon. You go rest.
Oh,
Not gonna happen.
Not gonna happen.
Thank you.
Okay.
Bye, everyone.
Bye.
Do you know how to sign us out?